Resilience has been defined as a dynamic process encompassing positive adaptation within the context of significant adversity. Resilience is not a personal trait that individuals do or do not possess. Thus, the term resiliency is best avoided because it connotates an individual characteristic, but rather, resilience is a product of interacting factors, biological, psychological, social, and cultural, that determine how a child responds to traumatic events. Resilience to trauma can be defined in several ways: positive child outcomes despite exposure to trauma, prevention of trauma recurrence despite high risk for further exposure, or avoidance of traumatic experiences altogether in the face of significant risk. All three of these conceptualizations of resilience are based on an ecological approach. Children who are exposed to traumatic life events are at significant risk for developing serious and long-lasting problems across multiple areas of development. However, children are far more likely to exhibit resilience to childhood trauma when child serving programs, institutions, and service systems understand the impact of childhood trauma, share common ways to talk and think about trauma, and thoroughly integrate effective practices and policies to address it, an approach often referred to as trauma-informed care. The context in which children live, learn, and grow shapes both their immediate and long-term well-being. Accordingly, children who experience trauma are more likely to exhibit resilience when their environments are responsive to their specific needs. Families, schools, community-based programs and services, and the individuals caring for children can increase the chances of resilience following childhood trauma when they become aware of the impact of childhood trauma, provide a sense of safety and predictability, protect children from further adversity, and offer pathways for their recovery. It is easy to remember the 4 R's of trauma-informed care. The first is realize. It is important to realize the widespread nature of childhood trauma and how it impacts the child's emotional, social, behavioral, cognitive, brain, and physical development, as well as their mental health. In addition, adults must be aware of the influence of trauma on family members, first responders, service providers, and others who may experience secondary stress. In some instances, adults endure the same traumatic events or circumstances as the child and may benefit from similar supports. The second is recognize. We need to recognize the symptoms of trauma, including how trauma reactions vary by gender, age, type of trauma, or setting. In addition, the adults in children's lives must understand that a child's challenging behaviors are normal, self-protective, and adaptive reactions to highly stressful situations, rather than viewing that child as intentionally misbehaving. Children's trauma reactions are understood to be adaptive efforts to protect themselves in response to traumatic events. For example, a child may be hypervigilant to an adult's anger or disapproval because in the past he or she experienced physical abuse by a parent. Or a child may disassociate or daydream as a learned response that enables them to avoid feeling or thinking about a traumatic experience. In addition, trauma-informed care means recognizing that trauma may influence a child's engagement in activities and services, interactions with peers and adults, and responsiveness to rules and guidelines. Respond. We need to respond by making necessary adjustments in our own language and behavior to the child's environment and to policies, procedures, and practices to support the child's recovery and resilience to trauma. Lastly, resist re-traumatization by actively shaping children's environments to avoid triggers, sounds, sights, smells, objects, places, or people that remind an individual of the original trauma, and protect children from further trauma, which can exacerbate the negative impacts of trauma and interfere with the healing process. How can caregivers help? Many of the ways caregivers can help seem simple and maybe like they are not enough. What is most important in times of trauma and toxic stress is for a child to have an adult, any adult, serve as a secure base. Some of these practices can be hard with a child who has been traumatized. For example, a traumatized child may cry a lot, and you need to be responsive to this all the time. They have experienced a pattern of non-responsiveness that you need to reteach them, rewire those neurons. We need them to understand that adults can be trustworthy and safe. This work can be exhausting and difficult. In the last module, we will talk about caregiver fatigue and when you might need to seek professional help yourself. For children who have experienced extreme trauma, abuse, and neglect, it may be necessary to turn to mental health professionals. Here are several types of evidence-based therapies for children who have experienced trauma. Make sure you find out who the licensed professionals are in your area that your program can contact when mental health consultation is necessary, and be sure that they are trained in evidence-based therapies, such as the ones on this slide. Lastly, we will look at the role of early intervention in the context of early childhood mental health. The Program for Infant Toddlers with Disabilities, Part C of IDEA, is a federal grant program that assists states in operating a comprehensive statewide program of early intervention services for infants and toddlers with disabilities, aged birth through 2 years, and their families. Congress established this program in 1986 in recognition of an urgent and substantial need to enhance the development of infants and toddlers with disabilities, reduce educational costs by minimizing the need for special education through early intervention, minimize the likelihood of institutionalization, and maximize independent living, and enhance the capacity of families to meet their child's needs. In Nebraska, early intervention is provided by the Nebraska Early Development Network. Toxic stress experienced early in life and common precipitants of toxic stress, such as poverty, abuse, or neglect, parental substance abuse or mental illness, and exposure to violence, can have a cumulative toll on an individual's physical and mental health. The more adverse experiences in childhood, the greater the likelihood of developmental delays and other problems. Adults with more adverse experiences in early childhood are also more likely to have health problems, including alcoholism, depression, heart disease, and diabetes. Child maltreatment and disabilities have a bidirectional relationship. Children with disabilities, including developmental disabilities, are at least 3 times more likely to be victims of maltreatment. And children who are victims of maltreatment often experience physical, cognitive, emotional, behavioral, and social problems, including attachment disorders, cognitive delays, and altered brain development. Research shows that later interventions are likely to be less successful, and in some cases are ineffective. For example, when the same children who experienced extreme neglect were placed in responsive foster care families before the age 2, their IQs increased more substantially and their brain activity and attachment relationships were more likely to become normal than if they were placed after the age of 2. While there is no magic age for intervention, it is clear that, in most cases, intervening as early as possible is significantly more effective than waiting. Children develop in an environment of relationships that begin in the home and include extended family members, early care and education providers, and members of the community. Studies show that toddlers who have secure, trusting relationships with parents or non-parent caregivers experience minimal stress hormone activation when frightened by a strange event, and those who have insecure relationships experience a significant activation of the stress response system. Numerous scientific studies support these conclusions. Providing supportive, responsive relationships as early in life as possible can prevent or reverse the damaging effects of toxic stress. How can early intervention help? Reauthorization of the CAPTA law in 2003 requires states to develop provisions and procedures for referral of a child under age 3 who is involved in a substantiated case of child abuse or neglect to early intervention services. In Nebraska, any child involved in a case of child abuse and neglect should be referred to the Early Development Network. Then the child and family will receive an IFSP, an individualized family service plan, to meet their needs and identify needs to build capacity. From pregnancy through early childhood, all of the environments in which children learn and live and the quality of their relationships with adults and caregivers have a significant impact on their cognitive, emotional, and social development. Infancy and early childhood present a prime opportunity to nurture positive mental health for children and parents alike, enhancing well-being and saving costs from mental health problems down the road.